If your dental clinic is getting messages on WhatsApp, but those messages are not turning into enough booked appointments, then the problem is probably not lead volume. The real problem is that your clinic has a weak lead conversion system. And that is exactly why so many potential patients enter your WhatsApp inbox, but never become actual patients. In this video, we are going to break down exactly where dental clinic leads are being lost on WhatsApp and why it keeps happening. The most dangerous part of this problem is that most clinics do not even notice it. They think they need more ads, more traffic, more leads, more budget. But in many cases, the real issue is much simpler than that. The leads are already coming in. They are just not being handled properly. And when lead handling is weak, a WhatsApp inquiry dies before it ever becomes a booking. For a dental clinic, WhatsApp is not just a messaging app. It is a first impression. It is a trust-building moment. It is a conversion point. It is a booking channel. And in many cases, it is the exact place where a patient decides whether to move forward or not. If there is a gap in that process, your clinic is silently losing business. Not just messages, not just conversations, appointments, treatment revenue, repeat visits, referrals, reviews. The first major leak is simple, slow replies. A patient sends a message. Do you offer teeth cleaning? How much are braces? Is the dentist available today? Can I book an implant consultation? And the reply comes an hour later, 2 hours later, sometimes the next day. Now think about what is really happening here. That patient is usually not messaging just one clinic. They are messaging 2, 3, sometimes 4 clinics at the same time. And the clinic that responds first does not just look faster, it looks more serious, more active, more professional, more reliable. A lot of clinics are not losing patients because of price. They are losing them because they responded too late. The second leak is a weak conversation structure. A lot of dental clinics have no real WhatsApp flow. Sometimes the replies are too short. Sometimes they feel cold. Sometimes it is just one line. Sometimes it is only the price. Sometimes there is no clear next step at all, and that creates friction because the patient is not only looking for information, they are also judging the experience. They are asking themselves, does this clinic seem organized? Does this feel professional? Do I trust these people enough to book? If the WhatsApp conversation feels confusing, flat, or inconsistent, the patient starts to feel uncertain. And uncertainty kills conversions. The third leak is one of the most common mistakes clinics make. A patient asks, how much does it cost? And the clinic replies with nothing but a number. That is where the conversation starts to collapse. Because the moment you send only the price, you reduce your clinic to a comparison point. Now the patient is no longer thinking about trust, experience, process, or professionalism. They are comparing numbers. And that is a bad position to be in, because dental services are not sold on price alone. They are sold on trust. They are sold on confidence. They are sold on clarity. They are sold on how safe and professional the clinic feels. The moment you remove that context, you make it easier for the patient to leave. The fourth leak is this. The patient is interested, but the clinic gives them no clear path forward. The patient is engaging. They are replying, they are asking questions, they are showing interest, but they are not being guided. What happens next? Do they wait for a call? Do they choose a time? Do they come in for a consultation? What exactly are they supposed to do? When the next step is unclear, even warm leads go cold, and this is important. Many leads are not lost because they are uninterested. They are lost because the process is unclear. The fifth leak is the one that quietly destroys the most opportunities. No follow-up. A patient sends a message. The clinic replies. The patient gets busy. They do not respond right away. And the conversation ends there. This is where many clinics make the wrong assumption. They think if the patient was serious, they would message again. But that is not how people behave. People get distracted. They delay decisions. They forget. They hesitate. They plan to come back later and never do. No reply does not always mean no interest. Sometimes it simply means the patient needed one more nudge. And the clinics that understand this are the ones that win more bookings. If your clinic has even 2 of these issues, slow replies, weak chat flow, price-only responses, unclear next steps, or no follow-up, then you are losing WhatsApp leads. And the worst part, hide, is that most clinics have no idea how much revenue is slipping through the cracks. The real problem is not that your clinic is not getting leads. The real problem is that your clinic does not have a proper lead handling system. Manual replies are not a system. Random conversations are not a system. Trying to remember who to follow up with is not a system. A real system moves every lead through a clear journey. Message, reply, trust. Next step, booking, confirmation, reminder. When that journey is clear, conversions improve. When that journey is broken, leads get lost. This is where many clinics think about WhatsApp the wrong way. They treat it like an inbox, but smart clinics treat it like a conversion channel. That means WhatsApp is not just there to answer questions. Its job is to reduce confusion, increase trust, guide the patient, create momentum, and move the conversation toward a booking. Once you understand that, you stop seeing WhatsApp as a support tool and start seeing it as part of your growth system. Now look at the business side of this. When a WhatsApp lead is lost, it is not just one chat disappearing. It could mean a consultation lost, a treatment plan lost, a whitening case lost, a braces case lost, an implant case lost, a repeat visit lost, a review lost, a referral lost. So this is not just a messaging problem, it is a revenue leak. And that is why clinics that improve their WhatsApp process often start getting better results without necessarily increasing ad spend. Because sometimes growth does not come from getting more leads. Sometimes it comes from handling the leads you already have much better. The first rule is simple. Speed matters. The patient needs to feel that your clinic is active, present, and responsive. Fast replies are not just about convenience. They are a trust signal. The faster the response, the warmer the lead stays. The longer the delay, the colder the intent becomes. That is how most silent lead loss happens. The second rule is this: clarity converts. Patients do not want a complicated process. They want to know what is available, what happens next, and how to move forward. The simpler you make that journey, the easier it becomes for them to book. Confused people do not take action. Clear people do. The third rule is consistency. One good reply today and one weak reply tomorrow is not a system. Every lead should get a professional experience. Every interaction should feel structured. Every interested patient should be guided forward in a clear way. Consistency turns chaos into control. And in dental clinics, control creates better conversions. The fourth rule is this: is not automatically lost. Many bookings do not happen on the first message. They happen after a reminder, after a second contact, after one more nudge. That is why follow-up matters so much. Not aggressive follow-up, not desperate follow-up, smart follow-up. Because the clinic that stays present usually captures more opportunities than the clinic that stays silent. If your clinic is getting WhatsApp inquiries, but bookings are still lower than they should be, then before chasing more leads, you need to look at your lead handling system. Because in many cases, the problem is not traffic. The problem is conversion. And once conversion improves, the same incoming leads can produce far better results. If you want more videos like this on dental clinic growth, booking systems, follow-up, and automation, follow the channel. And if you want the next video to break down what an effective WhatsApp follow-up system should look like for a dental clinic, comment next.